Hello and welcome to today's IHRSA webinar, Coronavirus Conversations, Club Operations Part 1. At this point, it is my pleasure to hand the floor over to Joe Moore, President and CEO at IHRSA. Joe, if you're ready, the floor is all yours.
First, I want to thank everybody for being part of the IHRSA family. IHRSA was created because we know that we can accomplish more together than we ever could individually. Typically, I would be seeing all of you at IHRSA 2020, our international convention and trade show. But you know what they say about the best laid plans. So these are going to be some rough times. But I want you to know that IHRSA is going to be here for you. We have the IHRSA lobby team in D.C. now, pushing Congress and the White House to make sure that our members and vendors are part of the stimulus packages. Jim Worthington, the IHRSA ex officio and chair, was on the phone today with members from the White House. He has very unusual access, the best access of any IHRSA member that I've ever known. So we're here protecting your interests. This is a very fluid situation, but we've been on top of it from the very beginning. We started posting coronavirus updates on IHRSA.org as soon as the news became public. We use info from the CDC, the World Health Organization. We use government sources, but only sources that are absolutely valid to make sure you have the best information and in a timely manner. So we're all together in this, the club operators, the vendors alike. Today's webinar is just one of the many ways that IHRSA will be helping you in these unprecedented times. Colin is uniquely qualified because he's learned a lot from his experiences. Thank you again for being part of the IHRSA family. And now back to you, Trevor.
Excellent. Thank you for those words. At this point, I'd like to introduce our speaker, Colin Grant. Co-founded in 2002 by Colin Grant, the Pure Group has grown from one yoga studio with 2 teachers in Hong Kong to over 30 locations with more than 2,000 staff and around 600 yoga and fitness classes a day across Hong Kong, Shanghai, Beijing, Singapore, and New York. Through the brands Pure Yoga, Pure Fitness, Pure Apparel, Nude Food, and My Pure Yoga, Pure Group now encompasses an integrated community dedicated to helping people lead a balanced 360-degree lifestyle. Good health and athleticism has always been a part of Colin's lifestyle. He played tennis semi-professionally and impressively ranked as one of the top-seeded players in Hong Kong for over a decade, participating in various international tournaments such as the Davis Cup and Wimbledon. Colin has an entrepreneurial spirit since a young age, including multiple successful business ventures. He fell instantly in love with yoga in 2001. 6 months later, Pure Yoga was born. Pure Group has grown into the undisputed leader in Asia's wellness industry. Colin, if you're ready, the floor is all yours.
Thank you very much, Trevor. I wanted to first of all thank Joe and the team at IHRSA, Christine, in particular John Olsinger, for giving me this opportunity to share my experiences. And these are tough times, but it's funny how Joe opened. I'm going to say similar things. These are unprecedented times, but we'll get through this and we'll get through this together. I also wanted to add that I have put together a set of slides for this presentation. It's not as clean and probably smooth as I would hope, but I put this together over the last couple of days, and it's been, even these last few days have been a bit crazy. I got to sleep about 2.5 hours ago. We had a big drama last night. So I'm calling from Hong Kong. It's 5 o'clock in the morning. So I'm going to do my best. I'm hopeful I can share my experiences with you. But all the slides in this presentation, I've included a lot of the signage that we've used going back to January when this all kind of came on our radar, about 3 months ago. You are all free to use it in any way, shape, or form. You may want to take my logo off. Feel free to do that. But what I'm saying is use as much of the content in this as possible. You can use it freely. Don't worry about nabbing anything. It's there for all of us to share. Get it up as soon as possible if you need to and if it's appropriate. So I wanted to start by saying these are very unprecedented, and they will be emotional times for all of you, as they have been and still are for me. There's no playbook. There's no crystal ball for this. It's going to be a bit of a roller coaster. It has been for us. But my advice from my experience is, I assume I'm speaking to the leadership teams in a lot of organizations. It's very important that the leadership team takes the emotion out, they act calmly, and that will cascade through the organization, both internally and externally. At the end of the day, it's our job to ensure that we provide a safe and healthy environment for our employees, our staff, our colleagues, as much as all of our members. That is critical, and it's something that has kept us in good stead so far. Now, the other thing I want to get, I'm not a doctor, so I'm not advising people from a medical perspective. I'm going to advise you based on the experiences that I've had with our clubs in Hong Kong, Singapore, Shanghai, and Beijing over the last couple of months, based on the circumstances we've had and we've experienced. Now, these are going to vary from city to city, club to club. And so what you should do is, I'm hoping, get some idea of, based on the decision-making process we went through. And I reflect back, as I have done in the last day or two, because of this presentation, there were some interesting things that came out of this that were a bit of a surprise, and I definitely want to share all of those. So I think, again, what I'm telling you I did is based on our experience and our circumstances. I'm not telling anybody how to run their business or what to take. That's left up to each of you, and that's important as well. So to set the landscape, because that will frame a lot of the decisions that we've made over the last couple of months. As I said, we're based in Hong Kong. Here we have about 22 odd clubs. Singapore, we have 8. We have 7 in Shanghai and 2 in Beijing. Half of the 35 odd clubs are yoga studios, and that's where we offer obviously only group classes. We do about 700-800 check-ins or swipes a day in those. The rest are kind of the big box gyms with the Group X class, spin class, functional floor, PT, lounge and what have you. We also have Nutri that offers the healthy nutrition side of the business. So I'm looking at the decisions I made were for that type of a business in those geographies, those cities. Now, the other thing is we are 75% dues, 25% prepay. So people will buy a 2-year prepay, or they sign up and do a monthly dues with a minimum of a 12-month contract. So that's the membership structure that we also had to kind of make certain decisions on. Keep in mind, we also went through SARS in 2003. Back then, we only had 3 locations, maybe 2 yoga studios. Sorry, yeah. And back in 2003, we went through a similar thing. I can remember it was very emotional. The big difference here is that now we have social media, and that has played a big role into this. And so back then we had the studios. We stayed open. We didn't close. It's a little different this time. Now, I'm also aware that some of you are, I would say, different stages of this. And it's, as kind of Joe said at the beginning, it's moving very fast. It's evolving. And I think what I've been through in the last 3 months, you guys may have to do that in about 3 weeks. Because back then, there wasn't much science behind the virus. Still hear conflicting stories. So now I'm going to kind of start in chronological order, going back to when this first came on the radar for us at Pure in Hong Kong. It was actually in December. December last year, we started reading and hearing about the virus starting out of Wuhan in China. And so we actually, based on our previous experience in 2003, we said, right, listen, We had the existing time a certain stock of masks, face masks, hand sanitizers, hand gel, and thermal guns to measure people's temperature. So we made a decision back then to start stocking up. We didn't know what we would need, but we knew if there came a time in the coming weeks or months that we needed them, if we needed them, everybody needed them. And I think we're definitely in that stage. We know that. Then we started getting, it started getting a lot more serious, I'd say, in early January. So early January, we made the decision, let me see which slides. In early January, we made the decision to start ramping up our hygiene at a club level. So we started, and at the same time, we started communicating to members this as well. So we started increasing the presence of cleaners, having them a bit more, and this actually was very important back then. Perception is reality. It's important, and it was important for us that members, when they came in, they could see cleaners walking around the club's studios, actively cleaning on a regular basis. We made it up front and central early on, and that was very important. The members want to feel safe, and also the staff wanted to feel they were in a safe environment. So that was a key learning, that the fact that having a lot more cleaners being active around the club was very helpful. At the same time, we increased the number of hand sanitization stations around the club. That also was very popular. So that was in early January. And then as we go through, we started also increasing information about the virus on social media, letting people know that we had hand washing, hand sanitizers around. Also, we had notices up in the club asking people to not come into the club if they didn't feel well. We were worried that people would be coming in feeling sick, so we highlighted that. I'm actually going through some of the slides. You'll see the images that I'm showing now on the presentation. Again, take anything you want here. These are images that were actually recently used, so I'm going to swing back and forth a bit. So in Shanghai, this is how we do a lot of the cleaning in some of the clubs. Every time somebody uses a treadmill, it gets cleaned. We have workers. Notice everybody's wearing a mask. Back in the middle of January, we basically provided masks for all our frontline employees, so they had to wear them. At first, we weren't sure. At first, we thought, well, do the staff need? I mean, you read all this stuff. Is it airborne? Is it not? But if someone walks in and they see someone wearing a mask, are we going to create more fear? It was the opposite. When people came in and they saw people wearing a mask. Now, keep in mind, we went through SARS. So there was a slightly different mindset over it, but it was the right thing to do for all the staff to wear masks. The members were more confident about the cleanliness of the locations. The other, so that was in early January. We also, towards the third week of January, we started doing a daily call. So we're now on call, I think, 54. Today will be call 54 at 5 o'clock every day. The leadership team is now 15 of us dial in, mostly from Hong Kong. Shanghai dials in, and Beijing, Singapore dial in. And we have a call. It varies from 15 minutes to 45 minutes, depending on the situation we run through. Okay, where are we at with our staff? Any active cases, any clubs? How are we doing with operations? How are we doing internally with staff? How are we doing with the government? Any regulations, any openings or closures? So those calls were on about day 54, and everybody is mandatory joins that. Because internal communication is very, very important, and that's where we do a lot of the internal decision making, and then how that cascades through the organization. So that was very important. So that was effective then. Things in Shanghai and Beijing were starting to get a bit more serious back then. And basically, towards the third week of January, places started to close down, meaning they were kind of being asked by authorities, perhaps it's not safe to open on. So our 7 locations in Shanghai and our 2 locations in Beijing closed on the 28th of January. And so we had to communicate to staff. But back then, at that time, it was kind of accepted, and there was no pushback. People accepted it, and you're kind of under pressure as well from the authorities now. Look, this might be the right thing. So that's what we did on the 28th of January. Now, Shanghai and Beijing, only one club opened since January 28th, last Friday, and we have a second club opening today. And I'll talk about that because that whole process was interesting. And then we had, in one of our calls, I remember towards the end of January, somebody raised the idea, listen, why don't we do mandatory temperature checks at the entrance to all of our clubs? That's where basically we have the thermal guns, and everybody walks in, and these are ones that don't touch the skin, so you just press a button, it measures the temperature. And there is a slide here, I think, which is our policies and procedures, and there's also some other attachments about Q&A on that. Again, please share those and use those. But basically, when it was first mentioned, I remember in a call, and I said, listen, if I walk in, you're going to measure my temperature. I think, people, we may actually create more fear, more paranoia. So we waited a few days, and then in the end, we thought, okay, let's do it. So we did it. It was absolutely the right thing to do, and we should have done it a few days earlier. Members would just say, thank you. I'm so glad you're doing that. This makes me feel like this is a safe environment. So doing, just like having the elevated hygiene around the locations, the fact that members had to have their temperature measured at the club entrance was very well received. And the policy around that, I believe, was anyone who has a temperature that's over 37.5, we do a second reading. We give them 5 minutes to sit down, and if the reading again is above that, we ask them to leave. And we've had to do it a couple times, no pushback at all, and people leave, and we obviously keep a note in their file. And so I'm going through some more slides again of the cleaning. So we introduced that early. That was actually February 1st. The week after, again, it started to become a greater issue, as it has done since then. And so what we ended up doing then was actually reducing the capacity of our group exercise class. That's in the fitness center. That's obviously all the classes in the group X studio, in the spin studio, and then in the yoga studios, everything. Most studios have 4 or 5 rooms where we offer classes. So we would take out 20 to 30% of the mats, or cover the bikes, and spread the mats out in the group exercise room, or limit the numbers. And that also was very well received, because you would walk in, and instead of seeing a packed room, you saw you had more space. That at the time was very well received, and we communicated that to all of our members in the middle, around the middle of February. Yeah. What we also did was we have Nutri that supplies smoothies and juices and salads, and that we actually had a promotion on high vitamin C product, because we did a lot of research around the time, and your first defense to getting sick is a strong immunity system. So we started also communicating through social media and internal signage about the benefits of a strong immune system. This is well received, and started to get people, because a lot of this is about education. And we're still learning now about this, but we try to educate our customers, our staff at the same time, which was, listen, if you're healthy, your first line of defense is a strong immune system, and you get that by eating healthy. So what can help is products with high vitamin C, and then also exercising, not over-exercising either, and finding a balance, leading a healthy lifestyle, not being stressful. These things will develop a strong immune system, and that's your strongest defense against the virus. So we did a lot of communication around that. We also launched a new yoga class called Immunity Booster Yoga, which was popular. We still have that. They're very, very popular classes. So we had a big focus around that. And then if we go back up to Shanghai, the clubs were still closed. We kept on, in early February, we were hoping to open around March. In early February, we were hoping to open around the middle of February. That didn't happen. So we would be communicating with our members. When the clubs were closed in Shanghai, so we haven't had any club closures in Hong Kong or Singapore. But in Shanghai, what we would do is, when the clubs were closed, we would get our PT, our yoga teachers, to send through either WeChat, which is the big social media platform in China, workouts of the day, and just generally try to engage them. What we would also do is we would do daily push videos through our app. We have our own app. So we would send them videos on yoga classes or workout of the day, and that would be done on a regular basis through our official app, member app. Also, the staff, the yoga teachers, the sales team, and also personal trainers and the group exercise would constantly engage with the members up there just to keep in touch, making sure they knew we were here. Even though the clubs were closed, we could do online training. They would also set up some either FaceTime or WeChat video classes, mainly one-on-one. So we had to engage them. Because of the limitations of the WeChat platform, we could only send out one notification a week on that platform, but on our own internal app to members, we would do that daily. So that was important. And we also had to give them regular updates on when we might be opening. And when we first closed end of January, we thought opening I think it was the 9th of February. Then we thought it was the middle of February. Then it was then it was March 2nd. We're planning on opening. And what happened, and this is interesting, because if anybody has closed clubs or ends up closing clubs, it's very important that you engage with your clients, your members, during your closure. The other thing we did, because we had all the clubs closed in Shanghai, Beijing, we used that time to do a lot of internal training. Because we had all the staff were on payroll, we still paid them. And it varies from team to team, but we still paid our team. We also went back to all of our landlords to get some kind of rent relief. We did have some success, and it kind of varied from landlord to landlord. We generally got a lot of good responses from landlords up in Shanghai, Beijing, because we were closed all of February. So we had zero income. The landlords, to be honest, were pretty fair. And then we also had to pay our staff. They're our most important asset. So we started then communicating to members. We're hopefully opening early March. That was the last bit then. And what we had to do, because also, listen, there's no playbook here. Even the authorities were like, okay, how do we open? We're on top of the virus. We can't open too soon. So what the government started to do was to release information on the websites. There's the main bureau in China is the Sports Bureau. And they would basically say, you have to apply to the Sports Bureau, and then you have to apply to your district office. And that's how they did the openings there. And you had to meet all this criteria. So the first chance we had of opening was going to be in the middle of March. So we filled out the form. You have to list out all your staff, tell the authorities where they're from. And our first application got rejected because 2 staff were from a province that had quite a few cases. That's another province outside Shanghai. That got rejected. We had to take them off the staff list. The first time we were going to open, so this is the restrictions. Okay, you can open. Based on the size of the club, you can only have 50 people at a time. They have to book by appointment. So we had slots, I think, of 90 minutes set. So you had a 90-minute slot. Say it was 7 o'clock to 8:30. You allow 50 people in. You could do PT. Everybody had to wear a mask. All the staff, all the customers. You had to do mandatory checks. What China's also done, actually, they have a code system. Every person in the country actually has a code in their WeChat account. So I think it's green, amber, or red. Green means they're clear and they're allowed to travel freely. Different codes mean they're only allowed to do certain things. Red means you're quarantined, you've got to stay at home. So we could only let people that had the green code. We had to do the temperature checks. They would come in, no showers. We had changing rooms, but no showers. We couldn't provide clothing. Anyway, so we filled this out, and then after the time slot of 90 minutes, everyone would have to leave, everyone out, and then we would have to basically clean the club for 30 minutes, clean everything, and then the next group would be allowed in. And we've been doing this. We were hoping to open in early March, and then eventually we were allowed to open last Thursday or Friday. So I can't remember the day. So we ended up opening under those one location in Shanghai. So that club opened. We had inspections similar. And to be fair, the authorities there want us open, but they also want to make sure they do it in an orderly fashion and a phased fashion. So the authorities came and did inspection. Oh, so you make the application, then the authorities come and inspect you. And then if it's allowed, they give you permission to open. So we got permission to open one location last week. On the back of that, yesterday we received permission to open a second location. We also got permission to open, to allow showers, I think by Monday. So on Monday, I think we got permission to open our third gym and the showers. But still, based on the club's size, there are limits. So one club is slightly bigger than the first one, so that we're allowed, I think it's 70 people there. Now, we're not charging anyone because it's limited. There's no Group X. There's no spin yet. That's the other thing. No Group X or spin. And then people come in. We're not charging a fee, but we're allowed to do personal training. So personal trainers aren't allowed to touch the client. They can't get closer than 1 meter. After every piece of equipment is used, we have to have a cleaner to clean them afterwards. And I think that's in some of the images. These images actually that you've seen, and I just clicked onto another one. These are taken from our studio, our fitness center in Shanghai that opened last Thursday. And so they would do the inspection. Members would come in, would disinfect it. We're allowed PT. We're allowed to charge for PT. And on the back of that, they said, listen, okay, we're now comfortable. You can open another location, and we're now comfortable to open the showers. So our next ask, and we're talking to the authorities in Shanghai. Beijing is not open. We're not sure when it's going to open. It's still kind of a bit challenging there for us. So, but Shanghai, we're hoping to let us maybe do group exercise in a room where we normally have, say, 50 people. Maybe we do 10. And again, everybody has to wear a mask, and the mats are spaced out. And then gradually, as the authorities become more comfortable, and we're learning as much as them, and we have to collaborate and work with them and make them look good. And we don't want to be the cause of any further outbreaks or problems. There's been very few cases in Shanghai, actually very few cases in mainland China for the last couple of weeks. So we have to tread slowly. We support it. We think it's the right decision. It's baby steps and gradually open location after location, learn and improve. And other districts and authorities are watching how we're doing to make sure that it's manageable, successful. And then, cinemas still aren't open. A lot of people are starting to eat out. The underground, the metro closes at 9 o'clock. It's normally, I think, midnight. So the city's starting to return to normal. So that's in Shanghai, Beijing. If I go to Singapore, and then I'll come back to Hong Kong. Singapore, the government's done a very good job being open, transparent, communicating very well with the people there. And so it hasn't been as dramatic, the impact on our business. I'll talk about the impact on the business when I start talking about Hong Kong, but Singapore. But now, I think they had 240 or 50 cases, I think, on MSI as of yesterday. But they're getting more imported cases, which is where we're at in Hong Kong. So they're on top of the situation locally, but people are now flying in. But we've kind of followed Hong Kong and Singapore, I'd say, have done a similar kind of process and control and what have you. So in Hong Kong, about 4 to 6 weeks ago was probably the toughest time. It was very emotional on all people. Now, because of the nature of our prepay and dues, and the clubs were still open, our check-ins, our swipes dropped about 30%. 30 to 35% the swipes would go down. We had a 2-fold increase in terminations. We had a 10-fold increase in suspensions. Well, that is, so people are paying a monthly dues, call it $100. They can go on a paid suspension of only 20 or 25, and they keep their membership status. Listen, they can also terminate if they want, and if they're outside the 12-month contract. We had a lot of pushback to allow free suspensions. But our feeling was, we're going to pay rent, we're going to pay salaries, we're staying open. We're doing still, 65, 70% of the normal check-ins. we didn't have the luxury to offer free suspension. My own feeling is if we did that, we may not have reopened. And we also, above all else, thought we were and believed we were providing a safe environment. We had elevated cleaning. We also used stronger cleaning chemicals, Dettol, bleach. In the past, members would hate the smell. Now they loved it. So have that at the entrance to your clubs. Have the mandatory temperature checks. Have staff wearing masks. We had to provide. We needed about 500 masks a day, which was tough at the peak about 6 weeks ago. We're running a bit low on supplies, and so in Hong Kong, terminations up, terminations double, suspensions tenfold. So we were asked, and we got a lot of pushback on social media and all sorts of things about doing free suspensions. We made the decision not to. I don't believe we had the luxury. And check-ins have gradually come back. Keep in mind, in Hong Kong, so the government closed universities and schools about end of January, early February. Two young girls who couldn't go to school anymore. So a lot of families, mine included, moved their kids and what have you outside of Hong Kong. So that drove suspensions, it drove terminations. On the suspension policy, we would only allow a maximum of 3 months suspension a year, but we have waived that, and it's month by month. So if anyone suspended in January or February, March, and didn't go towards the 3 months, and that's off the table. So we're going to allow that. But what's happening now is because of the increase globally, Hong Kong, we were doing very well. I mean, I think we're still doing pretty well. But the last 2 or 3 days, we've had a bit of a spike. We've had double-digit cases. And our big concern now is imported cases, where a lot of these families are now coming back because Hong Kong's safe. And also the borders are going up, right? Flights have been cancelled left, right, and centre, and there's a lot of quarantine measures. So all of our clubs in Hong Kong have been open. One thing you've got to be very careful about is, and I'm reading some notes now, is just your supply chain. How, and when we were looking for supplies of hand sanitizer, which have to have at least 75% alcohol, this is a virus. You need alcohol-based and not antibacterial swipes and gels. It won't cleans bacteria. So, but you've got to look at your supply chain to make sure that you can source it. When we were looking 6 or 8 weeks ago, the prices of the masks literally were doubling every day. We were placing orders of 50,000 masks on a Monday. We think we can get it Tuesday, it's $1 a mask. On Tuesday, it'll be $2 a mask. On Wednesday, it'll be $4 a mask, literally. And then the governments back then in Indonesia, Malaysia, Thailand, China started putting export bans on these items. I think the supplies are somewhat freed up. But it may get tighter now just because of the situation, the number of masks are needed. So you've got to look at your supply chain of all those items as well. Definitely setting up the cleaning stations around the club, and more visible cleaners helps. Just going through my notes. We also, things like, obviously the personal trainers and group exercise and yoga teachers, avoiding all contact with them, no touching, nothing like that, trying to keep a safe distance. And the check-ins, as people now are starting to come back to Hong Kong, the check-ins are going up. It's a bit more stable. The risk now is imported cases. So what we did actually this Monday, we put in place. Now, the other thing is actually, very important. When we applied these protocols to the members, which is, say, the mandatory temperature checks, it also applies to employees or staff. So from February 1st, all locations, all staff, when they turn up for work, get temperature check, it's logged and tracked. Anyone's over 37.5, they have to go home, for a couple of days, or anyone's got a cough or anything like that. We're hyper sensitive with our employees as well. But you can't have double standards. So the temperature in our back office, now everybody has to go to, we have 4 floors, goes to one floor to do the temperature check, we log it and write it down. any visitors or guests. So all these restrictions apply to, we have vendors that come in and change mats in the studios every now and then in the chambers. Those vendors have to have temperature checks. Any guests, any drop-ins that comes to our club, the same applies to them. But one of the big things is on Monday, this is our biggest fear. And we discussed it a lot last week, and we implemented on Monday that we would impose ourselves as a company on our staff and our members a 14-day quarantine if they return to Hong Kong from anywhere else in the world. So we sent out a push notification to all members, and it's the honor system, right? I mean, someone comes in and, they don't declare anything, there's nothing we can do, but we've been pushing out a lot of material. I think that's my next slide. This is one of them. So the next few slides talk about some of the, so this one is, we put this up in early January, I think, washing your hands. We also have this one in the change rooms, if you can see, wash your hands for 20 seconds. We also put this one up. We had members ask us to put this up. So we put this up, and then people would write in saying, so now you expect me to touch something dirty to close. I've got to touch the lid and close it. So anyway, we've kept these signs up. And this was another one about asking people when they first come, please wash your hands. Just having these signs, they're highly visible. It makes people feel better. And it's all about how they feel. And this is some of the standards we've done, I believe, and notifications. Again, photos. So mandatory temperature check. Again, take any of these. That's what we've had in the club. There's also, I sent you some documents on the Q&A and how we manage this process. Hopefully IHRSA can share that with everybody. These are the temperature checks. Actually, the guns we haven't shown how they do it, I believe, off the wrist. It's more accurate. Also, when you get the temperature guns, you've got to make sure you get the right ones. That also you calibrate them, because sometimes they can go off, and depending on the different machines, they're calibrated in different ways. This is the immunity class that we launched. Okay, so the sign now, updated mandatory self-quarantine for travelers. And then, so on Monday, we sent out a push notification to every member saying, if any of you have returned to Hong Kong, we were going to make it effective the 17th, Monday night, the morning of the 17th. Please, we ask you to self-quarantine yourself for 2 weeks, because we had a big influx. So we're in the second wave of this, where Hong Kong actually has done a good job. We're in control of it. We're managing the number of new cases. But now we have thousands of people coming back, in part because we're safe, but there's a risk there. 70% of the new cases in Hong Kong and Singapore in the last 2 weeks have people that have recent travel history, 70%. So a lot of countries are now doing this. I think New Zealand and Australia, as of last weekend, every person coming into the country was a mandatory. So we did this on Monday. We sent out something saying, right, if you've come in, please stay at home for 2 weeks to make the place safe. And I think it's one of the earliest slides with a bit of a, we upped the ante a bit and just said, listen, for the safety of everyone. Oh no, that's the temperature check. Sorry. There's one coming up. I'll show you that. But so on Monday, we put one out saying, if you've come back to Hong Kong, please self-quarantine. On Tuesday, we upped it by backdating it to the 10th of March, saying, if any of you have been away but are coming back since March 10th, please let us know. We will give you a 2-week free suspension. And we also upped it by saying, if you're also living with somebody who's under quarantine or a close contact trace, meaning if you returned or if you live at home and your partner or buddy that you live with is in quarantine, because you're also a risk, please stay at home as well for 2 weeks until they've also finished their quarantine. Now remember, this applies to staff as well. So we had our head of marketing came back last Friday from New Zealand. He worked on Monday, and then we put this in place. He's working home from Tuesday for 2 weeks from when he landed from New Zealand last Friday. So again, we would apply these. So you guys are probably getting close to this way, where once you get into phase 2, which is once your local case drops, you've got to be careful about imported cases. So we're at that stage where the risk is probably around more imported cases. So we did that. And we've got a lot of signage in the clubs warning people. I can show you another sign in a minute that kind of elevates that. No, it's not here. So the next slide is the high super C, which is the high vitamin C ones. And then, natural immunity defense, just talking about protecting your immune system. But the key thing now is we're at the stage where China is starting, our clubs in Shanghai, Beijing are going to start to open under very strict phasing of offering of what you can do, whether it's hours of operation. Everybody has to wear a mask, no showers, no group classes, no touching, mandatory temperature checks. Once the authorities feel comfortable, we'll gradually increase that. Hopefully by the end of the month, by the middle end of next week, I'm hoping we will be able to offer some group classes. Small ones, 10 people in a big room, and then gradually increase them. Singapore, Hong Kong, it's relatively stable, but now they've also, I think Singapore's done so. I know Hong Kong has definitely done it, which was anybody arriving from Thursday, from actually last night, has to do a mandatory home quarantine for 14 days. But we want to make sure that we keep our clubs safe, and so we're keeping them out as well. So that gets us pretty much up to now where tracking all the members when they come into the club. We get a push notification on Tuesday. We're sending a reminder today about the mandatory quarantine. And throughout this, we've also had, for instance, yesterday, Singapore, one of our clubs, there were 3 positive cases in the same building. They just sent us a notification. They weren't members, so we didn't need to act on that. We had a case on Monday where one of our staff flew back on Saturday, and somebody on the plane was a confirmed case. So he has to go into quarantine because I guess it's a confined space. It's looked at differently in planes. So he's now self-quarantined for 2 weeks. We had another case yesterday in one of the clubs where an office had a confirmed case. So everybody in the office is working from home. I think our facilities, we have the temperature checks, everybody's wearing a mask, we have elevated hygiene. It's relatively high standards of hygiene. And there's no close contact, no real close contact, but also it's for a limited amount of time, sitting there for 8 hours a day. That is kind of, I think, gets us up to where we are today. So I hope this has been helpful. As I said, use what you have here. If I have anything else, I'm going to be forwarding it to IHRSA and have regular contact to them to share best practice, what else we've learned. But I think some of the key learnings are, from our side, what worked was having hygiene visible up front center. It's important the leadership team takes the emotion out and communicates this also regularly to your staff. So I don't normally send company-wide emails. I prefer not to, but I've done 2 in the last month. The first one in early December was like, listen, guys, we've got to do this together. We will get through this. We're here to help people lead happy, healthy lives. Let's do this. Maintain high standards of cleanliness yourself, lead by example. And then I sent one last week saying, listen, let's not get complacent. Although we're on top of it here, now is not the time to be complacent. Let's do this together. Let's keep doing it. And a bit of a morale booster. So I've done 2 in the last kind of 6 weeks. So internal communication is very important. We've also, actually in Hong Kong, because our business has softened, so some of the KPIs, guests dropped 80%. So new members basically dropped 80%. And again, and what we did do starting about 6 weeks ago, we have a daily report that tracks check-ins. I think it's 5 KPIs: check-ins, new member units, guests, terminations, and suspensions. And we track each club each day, and we do a year-to-date comparison with last year. We do a week-on-week comparison and a week-to-date. So I can tell you today's Thursday, I'll get the report Monday, Tuesday, Wednesday this week compared to Monday, Tuesday last week and the week before and the week before, because I want to see trends. I want to see where the spikes are. I want to see how things are moving. So that KPI report, that level of detail by club, by day, and it normally comes out around lunchtime, helps us also drive these daily meetings at 5 o'clock that are going to carry on as well. Member communication, suspensions. Yeah, I think the biggest ask from our members over the last couple of months has been through suspensions. Listen, it's a safety first. If you think you're providing a safe environment, then, and that's the most important thing, and we believe we are. Again, everyone's wearing masks, temperature checks, both members and ourselves, and now we have this mandatory quarantine. I just hope we're not too late. We've got to make sure that we keep the clubs safe. So I hope this has been helpful. It's done a bit on the fly. I apologize. We have a lot of moving parts. Maybe in the future I can put something together that flows a bit better. But that's where we're at today. And listen, it's a roller coaster. Be prepared for a roller coaster. But you've got to steady the ship. The leadership team needs to steady the ship. You've got to work together. Bring your teams together. Sometimes we had staff that didn't want to work. Generally the staff have been amazing. They've been so supportive. But you can't force them. If they feel that way, if they don't want to come in or you've got to work with them and sit down. But if you communicate with them, you're open, you're transparent, you know that we're in this together, you lead by example, they're generally going to be very good. But at the end of the day, you can't force them. And if they want to take leave or they don't want to come to the clubs, well, it's their view and their decision, and you've got to honor that and let them do that. This is a tough situation, but we've been through SARS, so people have kind of been in a situation. Everyone's wearing a mask. They have done for 3 months. Social distancing for 3 months. We've been through that, so we're a bit more prepared. So anyway, I will hand things back to Trevor. And I hope that has been helpful. Again, I want to thank IHRSA. And over to you, Trevor.
Excellent. I do want to remind attendees for the helpful handouts that have been included with today's program. You can access those under the Materials tab. At this point, we're going to talk about some of the questions that have come in today. The first question we have, how many days have your gyms been closed?
So 28th of January to now. It's 50 odd days starting to open now. Hopefully all of them in Shanghai, all of the 7 maybe by the end of the month. We hope. The challenge because of the virus is around group exercise. That is because of the close proximity and what have you. So 50 odd days.
Excellent. The next question. Did you take the downtime to work with manufacturers to complete any preventative maintenance on equipment?
No, we didn't. We couldn't get into the clubs when they were closed. In Shanghai, the city was basically in lockdown. No one was no one was allowed in and out of their apartment block. So so we had to close the clubs down properly, carefully, which we've never done in the past for an extended period. But no, we didn't.
And the next question: could you please tell who checks and updates people's codes and who checks and updates people's codes?
If you're referring to the ones in China, the green and the red one, it's the government. They have a lot of controls up there around things like that. They're very careful. I hope that answers the question.
Excellent. And what was the milestone that the government used to determine you could reopen your clubs?
I think it was when they had a number of consecutive days of no cases in Shanghai. It could have been as many as 10 or 12. I don't think they had a particular number, to be honest. Again, there's no playbook for this, right? They're learning. They kind of did a lockdown of the city. Very, very few cases. Then a certain number of 0-day cases, which I think was low teens. And then they decided to go. And we weren't the first. Other places were allowed to open. Coffee shops could open. no seating, only takeaway, only 3 people in at a time. Everyone had to wear a mask, no touching, things like that. So they've done things in phases based on the degree of risk. And we're probably not the lower part of that scale. So we're kind of coming later. Cinemas haven't opened yet. So we think those will be next week. And for cinemas, it'll be alternate rows and no one sitting, any closer than 5 seats.
Excellent. The next question. In North America, we're being told masks might not be the most useful. And sometimes we're hearing reports that they can increase risk of infection. Is there a different usage protocol in Asia?
No, not really. I touched on it. The Singapore government was very upfront and said, listen, we don't believe a mask can help. We want to save them for the healthcare workers. Only wear the mask if you are sick or if you're elderly, if you're high risk. It kind of varies. But for us in Hong Kong and in Shanghai, it was different and people felt more comfortable. Perception is reality. People feel more comfortable. We have people in the office, some that do wear masks, some that don't. But in terms of the clubs, it's important that all the frontline did. People at Nude serving, the cleaners, most of the PT do. I think all the PT do. Some of the yoga teachers did. It was their choice. They didn't have to. But the frontline staff, receptionists had to. The sentiment over here is that you're better off wearing them, and that's what they do. And I've read the same reports that, if you wear a mask, you touch your face more. The best thing you can do is wash your hands and not touch your face, and that's basically what the WHO says. But if people feel better with a mask, they feel better with a mask. We can't argue with it, and we've got to respect that. And it was a good thing for us. But again, it's a different mentality over here.
Very good, very good. And 2 questions. Did you say you did or did not charge for suspensions? And could you share the percentage or group of people who canceled versus went on hold? Yeah,
so we did charge for suspensions. Suspensions is normally about 25% of the normal. It's about 22% of the normal monthly rate. The number of people suspending was relative to terminating was about 5 to 6 times more people ended up suspending than terminating in terms of numbers. But in terms of a normal run rate, our termination rate doubled. So instead of, call it 100 members suspending every month, it would be 200. If suspensions were normally 150, it went to 1,500.
The next question. I missed the info on the temperature gun. What was the brand or specs that you used to make sure it's a reliable option?
There's an image here. Hold on. There's a lot out there, to be honest. The other thing is when people are buying, be careful. There's a lot of scams out there. Be very careful. We almost got scammed with an order of 350,000 masks. But luckily the agent got onto it early and we didn't send the money. Be very careful. But they're all over the place now. To be honest, I will try and get the brands that we use, but there's dozens and dozens of good brands out there. I will try and find it. I don't have it on hand. Apologies. Yeah.
Excellent. Next question. Did you have to lay off any employees, or did everyone get paid when you were closed?
It varied. The staff that were on, mainly commission-based, but very, like salespeople, say some other staff that mainly commission-based, they're normally on a very, very low base. We ended up paying double the base or something. And the range could have been anywhere from 30 or 40% of their normal take-home to 80%. It kind of varied depending on the position. And if they were working, so some of the staff were working from home. We had to pay, I think most of the market paid about 20%. At the time, we felt, and that's the right thing, we've got to pay way above market. But, employees, they have to pay their own rent and food. So it kind of varied.
Excellent, excellent. Next question. How have you kept a positive and energetic environment on site for customers? Are there practices in place to ensure an optimal experience level?
It comes down to the culture in the organization, being open, being transparent, being supportive, that the staff feel you've got their back, and also that we're taking the right measures and taking their grievances seriously about whether we should do more with the members, or we should take more mats out, or we need more cleaners, or we've got to use a strong suit. If we do stuff like that and the members see that we're behind them, they feel better, they react better. But also making sure that they know they play a very, very important part in this.
Excellent. This attendee is asking, we have closed, the local guidelines were not clear, and we've now found other gyms have stayed open. What do you recommend if we decide to reopen? How do you approach that?
I think you've got to make sure that you provide what we're doing now. We're working on a rebound plan. Out of this, more people are going to want to lead healthier lives, and a lot of it is around safety and hygiene. So we're putting videos together, documenting all the elevated hygiene measures that we're doing now, that we will continue to do to make sure that we've got a safe and clean environment. We're adding 3 slides to our sales presentation that are going to talk about that, because that's going to probably be for the next foreseeable, for the future, top of mind for everybody, the hygiene. I think depending on the circumstance and the environment, you've got to choose to either stay open or close, depending, and you may be forced to, right? Some governments and cities are doing that, but safety first. And if you're seen as being responsible and doing the right thing, and that may mean closing or staying open, you've got to do that. But making sure that people know that you have a safe. And what we found was when members were coming in, they saw their temperature was checked, and they saw everything was cleaner. They would tell their friends, and the word would get out. And that's important, word of mouth from your members as well. They end up telling me, oh, I'm working out again. Oh, I'm going to Pure. Oh, it's great. This is what they do. And then the word gets out.
Very good, very good. How did you take care of your staff during this time?
Communication, open, honest communication. Listen to their grievances. Make sure they know that also that the company financially is doing very well, that we will get through this together. You don't need to worry. That's, because also the whole economy is struggling big time. But they need to know that they're working for a company that is prudent, that is doing the right thing for the long-term sustainability of the company, but also putting people's health up front and center, the staff and the members.
Very good. Were you getting negative feedback regarding opening? And if so, how did you respond?
Well, it's a mix. You're going to get, we get complaints no matter what we do. You're always going to get detractors. You're going to have people out there that are very, very fearful that may not come back for 6 months, and it doesn't matter what you do. You're going to get people that, I'm going to work out, I have to, it's safe, I don't mind. And then, mind you, you've got a group in the middle, and they will do it depending on how they feel and if they're comfortable, and that's the group that you want to try and pull in. You're not going to get everybody back, but you've got to do what you can and what you can control, and that's the environment within your locations. That's what you've got to focus on.
Excellent. What would your strategy be and when to attract new members again and re-enroll those who canceled?
Yeah, that's a good question. So we're preparing a rebound plan, and the 2 critical things for a successful rebound plan are timing and tone. Timing and tone. Got to get the right, you can't have it too soon, and you can't be too aggressive. What we're doing is we're going to go in the coming weeks, maybe next week, and start going to we want to get our suspended members reactivated, and in the club, we think they're the easiest. We then want to start looking at this group of members that terminated. Can we get some of them back? And then we have to get new guests in, probably probably middle of April. So, but again, it depends on the situation. We're in a much better, I'd say 2-3 weeks ago was better. We've now seen a bit of a spike. Monday, Tuesday this week, we saw a bit of a spike because people were getting nervous. When I say spike, I mean a spike in terminations and suspensions again, because the worry about all these people returning back to Hong Kong.
Very good, very good. With that, you have clubs in New York. This attendee is asking. You have clubs in New York, correct? How are you handling the outbreak and restrictions in the U.S.? And do you expect your experience that'll be a similar time frame of closure, 50 plus days?
So I was curious, how would we manage the closure?
It looks like how are you handling the closure, and do you expect it would be a similar time frame?
Well, in terms of how we'll manage it, we're constantly engaging with our staff to make sure. Well, first, I think you can do a lot of training, customer service training that you couldn't normally do when you're open. You've got to get whether it's your sales team, your yoga teacher, your group X, your PT, engaging through social media with members to make sure that the members know that, we care about them, even though we're closed. Send them online content through social media. Send things to your members, daily workouts, how to eat well, home workouts. Also, think about it. Your members are at home, right? Okay, what are they going to want? They've got a small amount of space. We did videos about home workouts, and we would push them to members every day. So that was helpful. It's hard to say how long it's going to be. We thought it was going to be a week, 6-7 weeks ago, and some of the clubs are still closed. We don't have visibility on Beijing yet, so you've got to be prepared for 1 month, 2 months, 3 months. We just don't know.
If your yoga studios used various props, did you get rid of them or consider getting rid of them?
No, they're disinfected between each class. The mats are, the straps, the blocks. And what we did, so there used to be at peak time 15 minutes in between class. That's been expanded to 30 minutes. So we have taken out mats, and we've expanded the time between classes to allow more time for cleaning. We used to hand out class pass. So if you're in Studio One, we'd give you a little pass, plastic pass that you get when you get into Studio One. We stopped doing class passes to stop any cross-contamination between people. But all the props are clean with disinfectant.
Excellent. And how did you present the reason for charging for suspensions, and what's the best way to ask people to continue to pay?
So the reason was that we were remaining open. We're remaining open. We have to pay our employees. We have to pay our rent. You can choose to terminate, or you can choose not to come in the club. We prefer that you lead a healthy lifestyle and come in, like the other 10, 20,000 people that are working out on a regular basis. We didn't have the luxury of waiving that, unfortunately. And we believe we provide a safe environment. So what was the second part of the question?
1 second, please. How did you present the reason for charging for suspensions, and what's the best way to ask people to continue to pay?
Yeah, so we've added the immunity yoga class. And we did a lot of communication, education around leading a healthy lifestyle, and the fact that your first defense against getting sick is a strong immune system. And there's a lot of science behind that. So we did a lot of communication and sharing all the hygiene measures that we do, temperature checks, everyone's wearing a mask, there's hand sanitizer all over the clubs, we have more cleaners, we've taken out the studio pass, we've taken out mats in group class, we've done all these, so you list out all the measures.
Very good, very good. And did the government implement economic support in any of the locations of your clubs?
Yes, they have. All three locations, yeah. Whether it's a tax benefit, a rebate for small business in food and beverage or retail. They have a whole host of initiatives that we're looking at right now, yeah.
Very good. And the last question tonight, what was the most challenging issue for you and your team to deal with during this whole process?
The request by members for free suspensions. We feel it was a very small group of probably only 30 people, but through social media they made a lot of noise. A lot of noise. When you've got 30 people complaining, but you've got 35,000 people coming in on a regular basis to exercise. And they were pushed back by some of the members saying, we're working out, you don't have to come and work out. And they were also asking us to close, actually. They said it's not safe, you should close. So that was probably the most challenging thing.
Very good, very good. Well, thank you so much for sharing your expertise. I do want to let attendees know that many of the handouts are helpful and answer many questions, and also that the session has been recorded. Colin, we'd like to thank you for sharing your expertise today. We'd like to thank our attendees for joining. Hope you have a great evening.